Invite on the stage the lady who is a role model for all the young aspiring lady doctors to choose a field like anesthesia and ICU, which looks simple but demands the nerves of a warrior to manage the critical patients. Dr. Rifat Zahid has always helped her students and faculty by teaching the best and standardized patient care. Madam has also always inspired and motivated her students in academic as well as extracurricular activities. Please give a huge round of applause for Madam Rifat Zahid, Assistant Professor of Anesthesia, Sheikh Zayed Hospital. Our course director will be giving you a course overview. Invite on the stage the lady who is a role model for all the young aspiring lady doctors to choose a field like anesthesia and ICU, which looks simple but demands the nerves of a warrior to manage the critical patients. Dr. Rifat Zahid has always helped her students and faculty by teaching the best and standardized patient care. Madam has also always inspired and motivated her students in academic as well as extracurricular activities. Please give a huge round of applause for Madam Rifat Zahid, Assistant Professor of Anesthesia, Sheikh Zayed Hospital. Our course director will be giving you a course overview now.
Ladies and gentlemen, Assalamu alaikum. I'm Dr. Rifat Zahid. It is my pleasure to welcome all the participants today for ICU Symposium at Sheikh Zayed Hospital, Lahore. I welcome all the eminent speakers, guests and mentors from anesthesia and different walks of life from all over the Pakistan. You have come here to share your knowledge with the students. उस्ताद हूँ इस पर मलाल थोड़ी है, मुल्क का मुस्तकबिल संवारना आसान थोड़ी है। बस उस्ताद ही फ़िक्रमंद है सबके अरूज के लिए, यहाँ किसी को किसी का ख्याल थोड़ी है। मज़ा तो तब है किसी खाक के ज़र्रे को मुनव्वर कर दो, सिर्फ अपनी ज़ात को रोशन करना कमाल थोड़ी है। मिटाना पड़ता है ख़ुद को कौम की तरक्की के लिए, ये काम कोई मामूली काम थोड़ी है। It is my privilege that I am standing here at this prestigious stage and giving the opportunity to say warm words of welcome to our mentors and pioneer of anesthesia and ICU department in Sheikh Zayed Hospital, Lahore, our dedicated and delighted teachers, Professor Muhammad Numan Ahmed and Professor Wasim Ismat. I cordially welcome you on the behalf of our department. A big round of applause for Professor Wasim Ismat and Professor Numan Ahmed. It is also important to note that our paramedical staff, especially our sisters, our technicians and our anesthesia assistants have played a vital role and help us in taking life-saving decisions. Your part is highly appreciable. A big applause of appreciation for the anesthesia head sister, Sister Tallat and her team for helping us. The theme of this symposium is to enhance the knowledge as well as skills of doctor working in the ICU through lectures and hands-on practice station. The aim of this event will be enable an ICU doctor to perform efficient and to improve the patient care. I would like to thank all the sponsors, coordinator and my consultant who made this event happen. Now I request all the doctors and sisters to sitting here to make use of this day to best their abilities. Now I would like to have a brief review of the course. Critical care focuses on resuscitation of unstable patient and allowing time for recovery as well as the effect of specific therapies to improve the patient outcome and prevent the death. The learning objective of our course are the participants are able to know how to support critically ill patient in ICU professionally, legally and ethically. They will be able to manage the sepsis according to the recent update guidelines. They will be able to manage different challenges faced during the mechanical ventilation, nutrition, fluid management, sedation and the paralysis. They will be able at the end to understand the role of ultrasound in the ICU. They will be able to manage the post-organ transplant patient in the ICU. The symposium format include the lectures on efficient critical care management and the hands-on training stations. The topics of discussions are duty of care in critical care management by the Professor Arshad Taqi, management of sepsis in critical care by Professor Jawad Asleem, percutaneous tracheostomy by Professor Ashraf Zia, choice of fluid and resuscitation of fluid in the shock by Professor Muhammad Isaaq, antibiotic in intensive care by Dr. Iltaf Ahmed, nutrition in critical care by Dr. Tanveer, concern in post-organ transplant by Professor Dr. Rana Asim, sedation and paralysis in critical care by Dr. Ehsan Khan, and use of ultrasound by Dr. Syed Mahmood Ali. The hands-on skill stations include, there are 4. The first will be percutaneous tracheostomy by Professor Ashraf Zia and me, and the station 2 EFA scan by Dr. Syed Mahmood and Dr. Adnan Bashir, and station 3 is challenges of mechanical ventilation by Dr. Rizwan Ahmed and the Dr. Farooq, and the last one, the difficult airway by the Dr. Syed Sajjad Ahmed, Raza Kazmi and the Dr. Shahid Nayyar. If you are not willing to learn, no one can help. If you are determined to learn, no one can stop you. Thank you. ये जो हमारी दर्सगाहों में उस्ताद होते हैं, हकीकत में यही कौम के ममार होते हैं। सुने रोदाद हम जब किसी की कामयाबी की, हर एक रोदाद में ये मरकज़े रोदाद होते हैं। Our first presenter of today needs no introduction, Professor Arshad Taqi. Sir is the name of excellence of knowledge. We are really grateful to him to spare time for this session from his busy schedule. He is renowned anesthetist and have a large number of marvelous achievements in the field of anesthesia. Currently, he is serving as a president of Pakistan Medical Commission and has been serving the Call Associate for decades. Today, the topic of his presentation is duty of care in the critical care. Sir, kindly come.